Hi there, Vincent Metzo from Swedish Institute Advanced Personal Training and Director of Education for KettleBell Concepts. I'm here with husahealth.com to talk to you about some assessments that you can use with your clients. At the Swedish Institute, we've had a massage program for almost 100 years. And we always use what we call the formula to deal with postural distortion patterns or deformities with massage. The formula is basically the concept of lengthening what's short and strengthening what's weak. Nowadays, we see personal trainers using things like self-myofascial release, stretching, as well as corrective exercises to apply the same concepts of the formula to the movement problems that they see in their clients. So what we're going to do today is we're going to go through a quick movement screen. We'll do the single leg excursion and balance test. Then I'll show you a couple different ways we can assess range of motion. And finally, some manual muscle tests for strength. We'll finish off with some techniques to disinhibit and strengthen the muscles that we may need to in order to get better, more efficient movements. So come on over and we'll start with the SEBT. All right, this is Jordan Chambrone, one of our instructors here in the Advanced Personal Training program at the Institute. And she's going to perform for us the single leg excursion and balance test. I've already explained it to Jordan, so she's just going to go ahead and do the movements. Go ahead, Jordan. When she does this test, we're actually assessing the standing leg. We give the person 2 or 3 trials, and then we see how far they can reach forward, posteriorly lateral, and posteriorly medial. And then we compare the 2 limbs. Now, movement assessments can tell you where things are happening, but they can't tell you why. They don't tell us whether it's because something is short, or because something is weak, or because potentially there's a motor learning problem. So after the single leg excursion and balance test, which tests both flexion, extension, abduction, adduction, and rotation, then we have to go on and do some specific joint measurements and flexibility tests. There are a number of different ways to measure flexibility. One thing we can do is some scanning tests. This is a scanning test for the hip flexors called the Thomas test. In the Thomas test, we're going to have the subject or the client pull this knee in so that their back assumes a neutral position, so I can just feel a tiny bit of space under the spine. That then assures that the pelvis is in the neutral position as if she was standing. Then we look at the femur and how much hip extension there is in relation to the plane of the table. If the person has normal length in the hip flexors, then the leg should fall slightly below the plane of the table, enabling approximately 10 degrees of hip extension. If their femur was parallel to the table, then we could say that there was some shortness in the hip flexors. The next test we'll do, Jordan, could you scoot back a little please on the table? Great. And then lay on your left side facing me. Good. Pull this bottom leg up towards you. Great. I'm going to swing around the other side. And then scoot your hips all the way back towards me. Good. Right there. And then hang this leg off the back of the table. Good. Just give me the weight of the leg. This position is for Over's test. An Over's test tests the length of the hip abductors, specifically the tensor fasciae latae. First, I have to move Jordan into extension, and then I'm going to lower her leg down and see when her pelvis starts to move. This is different than doing a stretch in this nice position where I really want to stabilize the pelvis. So I bring her back, and then I see if she can allow 10 degrees of adduction before her pelvis starts to move. Lastly, Jordan, could you swing your legs off the side front of the table here? Great. Could you put this ankle under this knee, please? The last thing I'm going to do is I'm going to look at range of motion of the medial and lateral hip rotators. Because when we're doing the abduction and the other movements, posterior lateral, posterior medial, in the SEBT test, rotation occurs at that standing hip, and we want to see if there's any limitation in rotation. So I'll check the available amount of medial rotation to see if the lateral rotators are short, and then I'll check the available amount of lateral rotation to see if the medial rotators are short. There are, of course, many different ways to measure flexibility. I'll be back in just a second. I can use a goniometer to measure the exact angles that are being displayed instead of just eyeballing it. So if I move Jordan into lateral rotation, can you hold your leg there? Great. Then I can position the goniometer and I can measure the exact number of degrees in lateral rotation and the exact number of degrees with the fixed arm perpendicular to the floor and the movable arm parallel to her tibia of medial rotation. It's also interesting to note, Jordan, could you lay on your abdomen? Try to keep your abdominal muscles tight and don't let your low back arch. Okay? And then lift your left leg up off the table. Take a little bit of the arch out of your back. Good. We can also measure hip extension here like we did with the Thomas test by putting the fixed arm of the goniometer parallel to her torso and the movable arm parallel to her femur. So there are lots of different ways to measure flexibility, and this allows us to better interpret what we see when we do something like the SEBT. Next, we'll go on to strength tests. When we do manual muscle testing, we use a 0 to 5 scale. 5 would be completely normal, they can activate the muscle. 0 would be some sort of neurological deficit. A score of 3 allows me to know that they can move the limb against gravity. So Jordan, can you lift up your leg here? Good. She's got full abduction against gravity, so I know she's scoring at least a 3 for this muscle. Now Jordan, don't let me move you. I press down to see if she can resist. I can palpate the gluteal muscles to make sure they're contracting here to determine whether she gets a 4 or a 5. Go ahead and rest a second, Jordan. When we press straight down with no rotation at the hip, that's gluteus minimus. Next, we're going to do gluteus medius. Jordan, lift up again, and now laterally rotate your hip to turn your toes to the ceiling. Good. You can brace yourself on the table there. Don't let me move you. I'm going to move down and forward to test gluteus medius. Go ahead and relax. Now, because Jordan wasn't able to stop me here and she gave in, I'm going to give her a 4 instead of a 5 for gluteus medius. Because she was able to assume that position against gravity, she definitely gets a 3. This is something that you need to practice. And comparing left leg to right leg helps to give you a better idea of what's happening with Jordan's strength relative to herself. Lastly, scoot back a little towards me, Jordan. We'll test the adductors. Give me the weight of this leg, and then lift the bottom leg up off the table. She definitely gets a 3, and then I'll see, can I push down? And the adductors definitely are a 5 on the lower leg. We could also do the same procedure for the medial and lateral rotators and start to put together this strength information with the length information in order to figure out what's going on with any problems we saw with the SEBT. Once we determine if it's an issue with length or strength, then we can decide which stretches and which strengthening or disinhibition techniques we want to use to address this specific client. In Jordan's case in particular, she's not lacking in flexibility. However, she did score a 4 instead of a 5 for gluteus medius. So to try to help her with gluteus medius, we're going to do some techniques to disinhibit or take away the inhibition from gluteus medius. Jordan, could you place this ball between your hip and the floor? And very gently let it sink into the muscle. Then, if you very gently lift your bottom leg up and down, it contracts, and then relax and try and let the ball go deeper in. It's okay if you shed a tear or two. Okay? But the longer you hold it, the more the muscle should feel it relaxes. This technique of disinhibition assumes that there may be some trigger points or some other things in the muscle that are neurologically stopping the impulses from getting to that muscle. If Jordan was lacking in flexibility, we could deal with the issue of altered reciprocal inhibition and stretch the opposing muscles, which may be inhibiting the abductors on that side. Lastly, we'll finish off with some stability and strength exercises for the hips, which you'll see have a lot of transfer just because of their similarity to the SEBT test. Instead of doing hip hinges, we're going to do a kickstand squat, which is also going to cause Jordan to have to use the medial and lateral hip muscles in order to stabilize her hip. So Jordan, could you straddle the kettlebell with your feet right in close? Good. And then imagine you're going to curtsy to the queen and put your left foot behind you. Good. Let your knees go out to the side like a plie and tuck. Perfect. And now touch the handle of the kettlebell with your left hand. Good. Keep looking straight ahead. Keep your chest up. Good. Try and put as little weight as possible on that back leg. Good. A little less forward leaning if you can. Nice. Now, if you're ready, try to pick up the kettlebell. Good. And place it down. Stand back up. Good. Squat down, pick it up. And squat down, place it. Right. This is also a gateway exercise to other single leg squats and deadlift variations. Thanks so much for your time. Jordan Chambrone, Vincent Metzo from Swedish Institute, Advanced Personal Training.